Good afternoon, everybody. We'll start with some introductions. So I'm Abdul Zubairu. I'm a GP by background, and I'm Medical Director of Southport and Formby Health.
My name is Danica Files, and I'm the manager for the 7-day GP service and have a very good interest in patient experience as well.
So our submission was entitled Improving Appointment Utilisation and Patient Experience of our 7-day GP service. So just a bit of background as to who we are. We are a GP federation made up of multiple practices, and we cover about 125,000 patients in Southport and Formby. We were set up in 2018, and our mission really is to provide services closer to home. We also want to provide economies of scale by working at scale, and also to have provide general practice with a voice. We have a number of services, but our biggest service is our 7-day GP service. So that's an access service for patients to access primary care in evenings and weekends. We've been going now, 7-day will celebrate its 5th birthday next week. So we've been going nearly 5 years. And our service offers appointments to a range of different clinicians. So you have appointments with GPs, practice nurses, healthcare assistants, mental health practitioners, physiotherapists, a whole range of different clinicians. We also offer a range of different services, so all the services that you would expect from your general practitioner and your GP surgery, so cervical cytology, ECGs, blood tests, and even ear irrigation. As I said, we've been going now 5 years, but last October there was a change in the contractual requirements of our service. And as such, we saw this as a real opportunity to get meaningful data and meaningful feedback from patients. So we sat down and decided what we were going to look at. And what we wanted to look at was the appointment data, so what practices were booking. We wanted to gain meaningful patient experience feedback. We also wanted to engage with external stakeholders, so people like Macmillan, patient participation groups, so that they could tell their stakeholders about the service and patients in Southport and Formby could get access to the service. We also wanted to engage with our local practices. They're all different, they all work in different ways, and it's really important that the offer of the service is consistent. So what did we learn? We learned, I'm not sure we learned this, we already knew this, but all practices are different. They all work in different ways. They have different systems, they have different processes. And we don't want to change those processes, but what we do want to make sure is that there is a consistency of offer. So practices are offering our service. Patients can get access to primary care in evenings and weekends. So what we did to do that is we decided we were going to engage with the practices. So Danica and the rest of the admin team frequently visit practices, remind them about the service, look at their appointment data, appointment utilisation, just to see how best they can get use out of the service. We also built a number of different reports, which Danica will show you shortly, looking at the total utilisation by our member practices. We looked at what type of appointments they were booking as well. And then there's a big difference in sizes of all our member practices. But what we wanted to ensure that was the fair usage amongst the practices, regardless of the size of the practices. The only real contractual requirement that we've had for the first 4 years before October was to report on the service hours. And we have to provide 136 hours of access each week. And this is something we did change from last October. So we changed how we looked at this. And you can quite clearly see from the graph, the dotted line represents 136 hours. And you can see that we always meet, most most staff frequently meet those 136 hours. The areas that dip below the threshold line correspond with Christmas and Easter periods where we intentionally dropped those service hours and we made up for them in later weeks. I'm going to hand over to Danica, who's going to talk a little bit about the appointment utilisation and also patient experience now.
So the reports that we look at each month, they look quite complex there, but I'll explain some of them. Just to give you some background, patients access our service by contacting their own GP practice. So we are not a contactable direct service to book into. So we know we've got a lot of work to do for patients to understand how they access the service, but also to support practices using us. So patients have to contact their practice. We try to look at things like how many appointments the practices are using as a whole, what type of appointments they're using, just so we can make sure that every patient within their area of their own GP practice is getting a fair usage of what they use. So just a couple of bits of figures on here. If you look at the very end column, which is the total appointments, we can see the highlighted top two practices are using quite a lot of appointments. We offer around 2,200 appointments per month, so quite a lot of appointments, but when you've got 16 GP practices all kind of fighting over them appointments and patients wanting to access the service, we have to look at this data to make sure that we're supporting the practices and how they can utilise their appointments to be fair and for their own patients to get what they need. So we look at the most used appointments, and we also look at the least used appointments as well, because it could be that that practice is not using the appointments because they don't know about the service. It could be a training issue within their reception team because they're not asking for it. So we do look at this across the board, and we meet with the practices and send this data out quite regularly. Another report as well that we look at, the greens and the reds, this is giving us the percentage of what appointments they're actually using. So I use this monthly and feed this back to the practices to tell them that you're really overusing GP appointments, but you're not necessarily using as many AMP appointments, which are really similar appointments. We also offer more AMP appointments than GP appointments, so they may be overusing. So it really opens up them conversations, them difficult conversations to have with the practices about how they utilise their appointments, and it works really well. And you can see month on month these trends starting to change after we've supported them using them. From a patient experience point of view, back in October 2020, we weren't very good at collecting data and listening to our patients, so we thought, how do we do that? So we started enabling text messages, and we did that straight away after an appointment, after a patient has left the appointment, and it's really key to capture them straight away. And we've seen a huge growth, as you can see there. We're now over 300 responses per month from 53. And all of that information, I painstakingly read through every bit of information. What we do find is anything that's negative, it's fed back straight away, or we deal with it straight away within the next working day. Anything positive about the staff as well, we share that directly with them, so it keeps the workforce really happy and keeps staff still wanting to come in and work for us, because we're a 0 hours contracted service with the clinicians that we have, so we have to really have a good bond with our staff and how we work. And then just a few bits about increasing our community engagement. So we do, because obviously the patients have to get appointments through their own GP practice, we understand we have to speak to patients as well. So we go out to Macmillan events. We go out to Macmillan events. We do lots of charity bits of information, like go out to patients and speak to them. We're really going into the community and seeing what they want. We actually learn directly from the patients and make changes from listening to them as well. So it's really like triangulating that information from what the GP practices need and what they want, also what we provide as appointments and is that the right thing to do, and also what the patients want from the service as well. On time.
Thank you very